Hi, myself Anup. We are from Banja Luka. Let me introduce.
Sure, I am Dr. Vanja Vidović. I am professor of cell biology and human genetics based courses here at the Faculty of Medicine. Also, I'm the head of the study program in medicine in English language.
Okay. Ma'am, can I ask, can you explain more about the education quality here?
Currently, we have around 240 international students, mainly from India, Bangladesh, Turkey, Canada, Germany, so all over the world. We also have around 3,000 domestic students which are enrolling here in 9 study programs. So medicine is one of the study programs which we teach in 2 languages, Serbian and English language. And what I would like to say, which I'm particularly proud of, that since last year, both Serbian and English study program. So what I would like to mention that I'm particularly proud of is that both of study programs, English and Serbian, are accredited by WFME since last year. And also I would like to mention that both international and domestic students, they have the same approach, the same quality of teaching in terms of professor's approach, clinical exposure, laboratory experiments, and etc.
So how experienced are the professors and teachers for the students?
So for each department, from clinical and preclinical courses, we have full professors mainly teaching with 20 or more years of experience in the teaching process. We also have juniors, which we call teaching assistants of different specialties. Particularly if we talk about clinical exposure from year 4th, 5th and 6th for each of, for example, for internal medicine. So each professor from University Clinical Center is, for example, teaching internal medicine courses. So we have 10 or more professors teaching this course depending on their subspecialty. So professor of cardiology teaches cardiology part of internal medicine. Professor of endocrinology teaches this part of internal medicine. So we have all kinds of specialties. Actually, professors who have different subspecializations are teaching also on this bachelor study program.
Okay. Since our parents are very concerned about the clinical practices, because there are many countries, they start their clinical practice from 2nd year, 3rd year. Can you tell me more about the clinical exposure here?
Sure. So how the study program is designed, so it takes obviously 6 years to graduate to be a medical doctor. So first 3 years we have a preclinical course training. So once they arrive at the school, for example, of anatomy courses, they will be 2 to 3 times per week exercises in the lab where they can actually teach and learn different things about anatomy. The same is for physiology, biochemistry, genetics, and all other preclinical courses where we prepare actually students to the clinical exposure. So once they arrive to the year 4, 5, and 6, they are actually all of the classes and all exercises that are held at the clinical center. So University Clinical Center, which I just mentioned, is our national clinical center. So it has a lot of different specialties, or actually all specialties and subspecialization departments where we treat people, from internal medicine, cardiology, nephrology, cardiosurgery.
We have different specialties.
Yes, so basically all of the specialties we have at the University Clinical Center, which is the biggest clinical center in this country. And students, all of the exercises and clinical exposure is held there from year 4 to the year 6. So first 3 years we have preclinical exposure here at the labs, where we actually prepare them for contact with patients. And last 3 years, they are actually all the classes and all practicals are held at the University Clinical Center. Besides the University Clinical Center, we have another facilities here where they actually are the classes are held. Center for Physical Rehabilitation, which was renovated last year. So it's a very big and nice complex where students learning different physical rehabilitation. Yes, so we have also primarily healthcare centers where they are also taking certain classes like family medicine, etc. So students are very well trained, domestic and international one, at the same level to become Doctor of General Practice.
Okay. Do our international students get the same access like Serbian students to all hospitals here?
Like I mentioned before, international domestic students, according to our syllabus, they have completely the same process of education, which also means they have the same availability or same access to all of these facilities, including University Clinical Center, family care centers, rehabilitation facilities. So we have the same access. Everything is the same for domestic and international students.
When it comes to the clinical practice in different hospitals, I know our students have their own hospitals here. Do we have more clinical exposure in the city then?
Sure. Our university, of our medical faculty, we have our own hospital actually, which I've mentioned is a tertiary level hospital, University Clinical Center. But also all these primary healthcare centers, rehabilitation facilities, secondary secondary hospitals, they all belong to the university. So
Okay.
yeah, so they're all university teaching bases actually. So where our students can attend different classes.
Also, when we compare to India, in India, like all the education, they have a big number of students in a class. Can you tell me more about number of students from first year to sixth year? Because I know till third year we have a number of students, and from third year to make it a better quality of education, we are making it less. Can you tell me more about that?
Of course, we have different standards here that we have to follow, different rules. So the first year, of course, lectures, we have no more than 100 students per amphitheater. When it comes to practical classes, we don't have more than 20 students at the first year. Second year is even less, it goes down to 15, then third year goes down to 10 or even 5 students depending on actually a class. So for example, if they have internal medicine practical classes, a group doesn't go more than 5 students per group. So the teaching assistant or professor can actually work with small amount of students so they can have better communication with the patients, etc.
And also, some parents used to ask me, if a student fail in an exam, how the university treated?
The system here, it might be a little bit different than in India. So students, we have 2 semesters, so it starts in October, ends in January, and then from February till June. Students have 9, sometimes 10 chances during the year to pass certain course. So for example, if classes finish in June, they will have in June and July 2 times to try to pass that course. If they fail that course, they will have again 4 or 5 chances the end of August, September, and October to pass these courses. So around 9 times we have exams scheduled for students per that year to give them a chance actually to pass the course. But if students work during the semesters, taking all the colloquiums, all tests and attendance, most of the students, they actually pass during the first or second time they actually attempt to take that exam.
Okay, and what is your message to the parents, those who are students who are willing to come here?
Not just being professor, but I'm a parent as well. First thing I would like to say that this country, this city is very safe for students, males and females as well. I would also like to say that professors, teaching assistant, faculty, all the staff who work here, we really are trying and take care good of students. Who also students who have some issues or something, they can always talk to me as a head of the study program or to the ladies in the student service. Also, we are trying to make better certain things according to the students' feedback here. So every year we are updating and trying to make their life easier here, not just academic life, but also what goes besides once the school is finished. We know it's not easy for 18, 19-year-old students to arrive here, as well as for their parents to let them go for such a long distance, but in the first place, the city, the country is very safe. Cost of living is not that high, so it's acceptable. And the school, we are trying to do our best to make their life comfortable here.
So parents, we have already discussed about the education quality here, and we are from University of Banja Luka medical faculty, and we have already explained all the classes, all the clinical exposure where they are doing, and they will be having a good clinical exposure comparing to any other EU countries. Recognitions which help our students to work in Europe.
Besides having this WFME accreditation, which basically allows our students, domestic and international, to work anywhere in the world they want, particularly if we talk about the European Union, we also have H+ accreditation Araben, which allows our students to work, for example, in Germany. A lot of our domestic students who graduate here with a bachelor, who become medical doctors, they actually do work in Austria or Germany, which is also part of European Union. So besides having these accreditations which allow them to work in European Union, we also offer them here a national exam where they can take our exam to get the license, which also allows them to stay and work in this country as well.
So I used to tell about NABIN recognition in my all the information video. So what is NABIN recognition? It is a accreditation from the Germany. Actually, we can check it is, we can type an NABIN from Google and you can select the country, you can select the city, you can select the university. So you can see a H+ accreditation. So it allows our students to work in Germany. So when you choose a country, a university, please follow these regulations. So it will make a better future for our students. And ma'am, what is your experience working with our students?
It's been actually 4 years since I'm working with international students. I am very happy, I'm very pleased with the knowledge they're coming with to our country from their high schools. I could say that I'm very happy and very pleased to work with our international students, and this has been 4 generations already that I'm teaching and working with them. I could say I'm very pleased with the knowledge that are coming from India and other countries from their high school, so it wasn't that challenging to work with them in academic terms. However, we do have some cultural shocks that are coming to in times for them to adapt, but that doesn't last that long. So maybe after a month or 2 months, our international students, they actually adapt here, and there are no any problems working with them.
So I'm glad that our students are very happy here. And Professor, thank you for the information. I hope these informations will help our students and parents to choose their university and country wisely. Thank you for your time.
Thank you very much.